Welcome back. This is Kirti, clinical psychologist, certified ABA therapist and HOD of psychology department at Daffodils CTC, Hyderabad. So today let's explore another important topic, and this topic is again a query or lot of concerns which we get from our parents. That is, how should we reduce our child's cry, that means excessive cry and screaming. So what happens is, as you might all know, crying is a mode of a communication which child tends to use, or it could be like a mode of expressing their anger or a frustration. But what if this crying or a screaming is going excessive, extreme? Then what happens is it causes overwhelming, or it causes a distress to the child or as well as the caregiver. So let's see today how we can reduce this excessive crying behavior using a little ABA strategies. So before that, I would like to say why do children usually do the crying or do this excessive crying? It could be a numerous reasons, but when we pick a few of them which are most important, first would be due to any physical discomfort, could be hungry, could be any sleep disturbances, could be a fatigue, could be like a child needs that attention from the caregiver, or could be a fear, could be a frustration, could be the angry. Any of these could be a reasons for a child to do this excessive crying behavior. So how we can deal with this? Here comes the ABA, which is a very helpful therapy, and the techniques of ABA really helps the parents to reduce the child's excessive crying behavior. So again, as I keep on saying in all the videos, before we do any strategies, the first step is to do a functional assessment. That is to identify the triggering point why the child is doing a excessive crying. So always for these behaviors, there is a purpose. So that purpose, that means the antecedent or a triggering point has to be identified. When we able to identify it, it could be your attention, or is it like child needs some desired object and just shows it in a crying behavior. So it could be anything. Child is hungry, child is very frustrated, is very anxious, feared of something. Any of these could be a triggering points. So first try to do that assessment and try to find what is the function of that excessive crying behavior. When we are able to identify this, the simple strategies which I am going to say now will really help when you start working on them. So the first strategy is again, and a very important as always in reducing any of the challenging behaviors, is teach communication skills. Teach appropriate communication skills in order the child should be able to express instead of crying. That express of their need could be, or their discomfort could be anything. We need to teach using simple words, or it can be cues. Cues could be a visual cards which you can teach them. They are very angry. Just give a small visual card of angry. Make them give that to us instead of crying excessively. So when you teach this simple technique, what happens is the child will be slowly able to give you the card instead of crying. That is what we are trying to replace that behavior to an alternate appropriate behavior. So again, when you are able to teach that alternate appropriate behavior, what you have to do immediately is reinforcement. A positive reinforcement is a very powerful technique when the parents start using it. Again, that reinforcement could be a small praise, a small incentive, which could be a candy, cookie, a small favorite activity, could be anything. But the reinforcement has to be provided for a desired behavior. And the next important thing would be using a visual schedules or a social stories. Visual schedules, I would be telling you in detail how you have to do and teach this visual schedules, but I would be saying in a simple terms, for example, the child is very frustrated while seeing some unique thing, some change in their routine. So they get frustrated and they just throw that excessive crying. because they are unable to communicate. So when there is a visual schedule, that is a proper schedule for the child from morning to evening, which is a visually appealing, that will make the child reduce their fear and frustration in orderly, their excessive crying behavior will also reduce. So next strategy is like developing a calming strategies. See, usually the excessive cry could also be little child is overloaded with the sensories. So if you give a calming routine, could be like is unable to bear the noises around, just give a noise cancellation headphone. Instead of excessive cry, if you teach them to use those headphones in order to escape from the noise environment, this will help them to reduce that crying behavior. So you are giving a sensory calming activities. So this is another important strategy which you have to be focused while seeing like what could be the reason for an excessive crying behavior. So these are very simple techniques, but again, please remember, seeking a professional assistance is very, very important. You have to meet a behavior therapist or an occupational therapist or a speech therapist in order to understand your child's reason for excessive crying and try to implement these strategies which have been said along with their support and guidance. So please remember, every child is unique. Every child's need is unique. So you need to understand why the crying behavior happens, and please, I have to repeat this because this is very important. Consistency and patience are very, very important when you're implementing these ABA techniques. So consistency, like make sure the same strategy is followed every day, and patience. It might take little time, but the progress, the reduction will definitely happen in a problematic behaviors. So I would like to end this video saying that please maintain the consistency. And if you want to know any more about the child's development and psychology, please feel free to contact us at Daffodils CDC, Hyderabad. Thank you.